Welcome. This is a presentation about the Health Opportunity Index, developed by the Virginia Department of Health, Office of Minority Health and Health Equity. The Health Opportunity Index is a new feature to the 2012 Virginia Health Equity Report. In this presentation, we will provide an overview of the Health Opportunity Index, the HOI, and explanations on why and how the Health Opportunity Index was developed. Further, we will identify and explain the social and economic variables used in creating the Health Opportunity Index and show how opportunities to be healthy are distributed across Virginia. We will also show examples on how to use the Health Opportunity Index, review the process, and then finally explain the benefits of using the Health Opportunity Index as a tool to understand community health. The Health Opportunity Index, also referred to as the HOI, is a new feature of the 2012 Virginia Health Equity Report. Because the HOI is a new tool, we have created this presentation to help you understand how to use the Health Opportunity Index and its benefits. The HOI was developed to identify key social and economic factors that affect the health outcomes of the residents of Virginia communities using a measurable score. The HOI score provides an estimate of how strongly certain social factors contribute and interact to shape health at the local community level. The Health Opportunity Index provides clues to selecting the location where community-specific interventions would be more effective in promoting health. Not only does the HOI assist in identifying such areas, but it also can help create a positive understanding toward the need for change within a local community. The HOI was developed to assist the public, businesses, policymakers, communities, healthcare organizations, and public health professionals seeking information to understand the factors that impact local community health status. The Health Opportunity Index tells a story that can be easily understood by the local community. In using the HOI score, please note it is not intended to blame a community for problems identified in that area. It should help to identify priority areas and further understanding on how a broad range of factors that span beyond the health sector interact and impact opportunities for people to live healthy and productive lives and realize their full potential. These factors, in many cases, proceed and are out of the control of the people they affect. Let's look at why the Health Opportunity Index was developed. The purpose of the HOI is, first, to demonstrate how clear, fairly simple social and economic variables can interact to allow both positive and negative health conditions to emerge. In addition, it provides a bird's-eye view of Virginia's landscape of opportunity and offers a new perspective on the highest priority public health issues, which in turn can be targeted for intervention. And primarily, the Health Opportunity Index was developed to provide the general public, policymakers, public health practitioners, healthcare providers, community organizations, and business organizations insight into how social, economic, and environmental factors, including where someone resides, affect health outcomes in any given community in Virginia. Now let's look at how the Health Opportunity Index was developed. A key method to the development of the HOI was geographical analysis. This was done using geographic analysis tools such as Geographic Information Systems, or GIS, that help to show how the geographic distribution of health and disease is related to the social determinants of health factors, such as race, class, and geography, which are key socioeconomic, demographic, and environmental processes that influence health outcomes in Virginia. The HOI analysis was conducted using census tract level data. Census tracts are, in terms of territory, the smallest level at which data is collected. Analysis at this level enhances understanding of local communities at the sub-county and sub-city level. As you learn more about the HOI, you will find that when used to predict a well-established measure of community health, such as life expectancy, the Health Opportunity Index explains approximately 87% of the difference in this measure across Virginia. The outcomes from the HOI suggest that targeting certain specific state and local policies across Virginia could have a significant effect on health outcomes and health equity. In developing the Health Opportunity Index, the first step or objective was to ensure that it created a reliable measure. To achieve this, we decided to test the combination of the subscores of the Health Opportunity Index against a well-established measure of health. We determined that life expectancy is such a measure of the health of a community. We therefore used life expectancy to assess how effectively the Health Opportunity Index was measuring what it was created to measure, the comprehensive health status of a community's social environment. Now, let's explain the importance of selecting life expectancy as a comparative measure. Life expectancy is a generally accepted comprehensive indicator of health across a population and across the lifespan. This is because it summarizes the overall health of a population in an easily understood manner. It answers the question, how long a life can I expect to live if I am a typical member of my local community? And, more importantly, life expectancy incorporates the impact of all causes of disease at each age group. The second step was to identify variables that impact the social, economic, environmental, and demographic processes known to strongly influence health. These variables had to be measurable at the census tract level and also needed to clearly reflect differences between rural and urban areas, urbanized and suburbanized, and mountainous areas of the Commonwealth. The third step was to further review the list of the identified variables in order to select the best predictors. The variables capturing clear social and demographic processes were chosen and combined using several spatial techniques until the best combination that predicted life expectancy was found. 10 variables were ultimately chosen. We will discuss these in detail on the next slide. The fourth and final step was to compute the composite index, the Health Opportunity Index. Now let's look at the 10 social and economic variables that were included in developing the Health Opportunity Index. The first variable, educational attainment, measured the level of education that was completed and the level of school enrollment. The second one, population density, measured the population concentration of the place where a person lives, for example, whether rural or urban. The third, racial diversity, measured the number of different races in a community. The fourth variable, material deprivation, measured the number of people unemployed, the number of people who have a car, percentage of people renting their home, etc. The fifth one, population churning, measured the number of people that moved in compared to the number that moved out of a neighborhood. The sixth, job participation, measured the percentage of people aged 16 to 64 who are employed or looking for work. The seventh variable, income diversity, measured the range of income categories. The eighth one, affordability, measured the amount of income spent on housing and transportation costs. The ninth, EPA environmental hazards, measured the levels of cancer risk, respiratory risk, and neurological risk. And the 10th and final one, local commute of workers, measured the number of workers that move into a neighborhood compared to the number that move out to go for work. These 10 variables together constitute the Health Opportunity Index. This map of Virginia shows the distribution of the Health Opportunity Index for census tracts across the state. The map shows how all the 10 variables that make up the index collectively impact the Commonwealth. When you look at the map, you see that the Commonwealth has concentrations in clusters of high and low Health Opportunity Index. The map's legend summarizes the relative score. The darker blue areas indicate high health opportunity, while the yellow areas indicate low health opportunity. As you can see, the map shows the highest health opportunity areas are in Northern Virginia and extended through the northern half of the state. The map shows that the low health opportunity areas are situated across South Side, Southwest, Eastern Shore, and inner city areas of Virginia. Now that you know why and how the HOI was developed, let's begin the process of navigating through the HOI. First, we will look at how the HOI predicts life expectancy. The first step is to determine the level of health opportunity for the area of interest, that is, whether the HOI is high or low, using the Virginia Health Opportunity Index map. Remember, the composite map is an indicator of current health opportunities across the state. The darker blue areas indicate high health opportunity, while the yellow areas have low health opportunity. As you look at this map, you can readily see that the health opportunities are not distributed smoothly or randomly throughout the state. This is because the dark blue areas and the green areas tend to be located in distinct regions of the Commonwealth. After looking at the Health Opportunity Index map, the next step is to see the distribution of the life expectancy at birth, our example, for the chosen area in the life expectancy at birth map shown here. The legend on this map progresses from blue areas, which have high life expectancy, to the yellow areas, which have low life expectancy. The blue areas need little intervention and are therefore low priority, while the yellow areas need more intervention and are considered high priority. In brief, to understand the map and the use of the Health Opportunity Index, remember that areas with lower priority have higher life expectancy, while areas with higher priority have a lower life expectancy. In using this analysis, remember higher priority areas are areas that will benefit the most if more opportunities of health are implemented into the area. Next, let's look at how the Health Opportunity Index and life expectancy are related and how their combined relationship is distributed across the state. This slide gives you an overview of the life expectancy map and the health opportunity map seen earlier. Map 3 shows the strength of the relationship between life expectancy and health opportunity. The blue areas show a strong and positive relationship, whereas areas in yellow indicate a weak and non-positive relationship. A positive relationship is one where the higher the HOI, the higher the life expectancy. A non-positive relationship is one where the higher the value of either the HOI or life expectancy, the lower the corresponding value. As you recall, the Health Opportunity Index was developed to provide insight into how social, economic, environmental, and geographical factors affect health outcomes in any given community in Virginia. So far, we have looked at two maps, one that shows the distribution of the HOI and another showing that of life expectancy. Our goal is simply to find how these maps relate and what these relationships tell us about various communities. Using the HOI as a baseline, we can compare the outcomes of communities with high health opportunity with those that have low health opportunity. Because with the Health Opportunity Index tool, you can determine factors which are positively or negatively impacting their health environment. Policymakers and statewide agencies can use the HOI as a tool for identifying high-priority communities and understanding their needs in the context of the various social determinants of health. Because communities have unique characteristics, these determinants vary in their impact among communities. In the following slides, we will introduce you to another way of using the Health Opportunity Index. Now that we understand how the Health Opportunity Index tool and life expectancy work, let's try and use this tool to examine issues that are unique to a specific geographic area. First, using the life expectancy at birth map, identify the life expectancy for the census tract or tracts of interest. For this example, we will be looking at the Buckingham County area. The arrow points to the location of Buckingham County on the Virginia map. Using this map, you can compare how Buckingham County, or any area of choice within Virginia, compares to other counties. Buckingham County is an example of the areas with a big difference between the lowest life expectancy value and the highest life expectancy value. You can see that in the southern portion of the county, in darker green, life expectancy is higher, between 74.6 and 75.8 years of life, while the northern part, in light green, has lower life expectancy, between 72.7 and 74.5 years of life. Within this county, you can observe a life expectancy difference of approximately 3.1 years. This range demonstrates that if you live in this county, your life expectancy will vary depending on where you live, which suggests that in regards to health, where you live matters. The next step is to identify a variable of interest. For this example, we will be looking at educational attainment in the Buckingham County Census Tract. The educational attainment variable looks at the people in the community and considers their years of education and the number of people between 3 and 24 years of age that are enrolled in school. Now that we have determined our variable of interest, in this case educational attainment, we can show the distribution of this variable in our target area. In this example, the map shows that the Buckingham area has low educational attainment. The yellow areas have low educational attainment, while blue areas represent high educational attainment. Using the identified variable of interest, in this example educational attainment, you can now also determine its relationship with life expectancy. Now let's pull all this together. The first map in the top left corner shows life expectancy in the Buckingham County Census Tract, while the second one in the top right corner shows educational attainment in the same location. Please note that life expectancy in Buckingham County Census Tracts is below the state average, and educational attainment in the county is also low. The third map at the bottom displays the relationship between educational attainment and life expectancy in Buckingham County Census Tracts. According to this map, the relationship between educational attainment and life expectancy in Buckingham County is a weak positive relationship. This indicates that the lower the educational attainment, the lower the life expectancy. This means areas with lower educational attainment tend to have poorer health outcomes. In examining education attainment as a predictor of life expectancy for the Buckingham area, the following conclusion can be reached. Education attainment is positively associated with life expectancy in the area. In other words, as education attainment levels go up, so do life expectancy levels. Similarly, as education attainment levels decline, the life expectancy levels decline as well. We can use the same process to see which of the 10 variables are strongly associated with life expectancy in any census tract of interest within the state of Virginia. So let's recap what we did. First, we identified the life expectancy for our census tract of interest. Please note that this could be several census tracts. Next, we identified the variable of interest in the specific census tract. And finally, we used the base maps legend to find the association between the selected variable and life expectancy to determine the strength or weakness of their relationship. In the previous examples, we demonstrated the process of identifying health priorities from a specific county or census tract. Although examples in this presentation have been limited, the same process can be followed to see which of the 10 variables are strongly associated with any specific health issue. For example, cancer, diabetes, HIV, birth outcomes, etc., to see how those health issues relate to the Health Opportunity Index. Using this process can help understand which localities have more occurrences of the negative outcomes in those health issues. To investigate the relationship between the HOI indicators and specific health outcomes, similar to the procedure presented earlier, the process would involve, first, identifying the health outcome of interest, for example, cancer rates. Next, identifying the variable of interest, for example, EPA environmental hazards, whose relationship with the health outcome identified in the first step, in this case cancer rates, you are exploring. Finally, remember that you need to use the base Virginia HOI composite map to find the association between the two or more indicators to determine how strong or weak the relationship is. Based on the strength of the relationship, the census tracts with strong relationships can be pursued for further exploration or can be designated as priority areas. Now we can see that similar policy goals can be achieved whether you approach the use of the Health Opportunity Index with the focus as a local community or from a statewide health outcomes perspective. A local focus approach could involve location-specific goals, such as priority social determinants of health for a census tract or health district. A statewide approach, on the other hand, could involve finding areas of the state that deserve priority attention for specific health issues, which are of concern statewide. More examples can be found in the full 2012 Virginia Health Equity Report and on the Office of Minority Health and Health Equity website at the web address seen on the screen. As you can see, the Health Opportunity Index can serve as a valuable tool for everyone. The HOI can assist us in identifying the key factors that are negatively and positively impacting the health outcomes of our communities. Not only can it shed light on what factors influence life expectancy, as illustrated in our examples, but the HOI can also be used as a baseline measure to better understand a number of health issues. The HOI as a measure of the social determinants of health allows us to compare well-specified outcome measures such as life expectancy, HIV, and low birth weight rates with unique local social environments. This will help communities in a number of important ways. First, it will identify locally unique social determinants of health that shape health. This is important given that the combination of variables associated with health outcomes vary across communities because of different local, social, economic, environmental, and political dynamics. It will also help us learn from communities with good health despite adverse social determinants of health. Some communities may have better outcomes than expected. This is an opportunity for those communities to learn and share with others. It will build collaboration across all sectors to better understand community health and promote health equity. This is not just about health and medical professionals. This is about health, medicine, education, housing, land use planning, public safety, economic development, transportation, community residents, faith communities, and nonprofits working together to develop policies and programs that consider and actively promote health equity, using the maps and other resources together. It will emphasize that where you live, work, and play matter, and it will identify statewide policies and programs to address those conditions and other social determinants of health, for example, access to healthy food, community safety, quality housing, and so forth, that are necessary to promote health equity. We hope this presentation has demonstrated the value of the Health Opportunity Index and helped explain how to use it. Our ultimate goal is to improve health equity for all, and the Health Opportunity Index is a vital tool towards achieving that goal. We hope that this empowers and prepares you to do your part. If you need additional information, please review the 2012 Virginia Health Equity Report, which you can find at the web address seen here. Or contact the Office of Minority Health and Health Equity at 804-864-7435. Thank you for watching, and thank you for your partnership.